likely strain, sprain, and fracture their arms or legs. More serious injuries are caused by blows to the head, which can be fatal. Let's go through a few examples. 1. An employee slipped as he entered the building and fell headfirst down a flight of stairs, hitting the concrete floor 1.3 meters below. He died as a result of his injuries. 2. An employee slipped in a dark car park outside his workplace and strained his back. 3. Employees had to walk around stuff that had been left blocking a passageway in an industrial facility. One of the employees slipped, sprained his knee, and hit the back of his head on the floor. 4. An employee tripped over a high door sill and dislocated her shoulder as a result of the fall. 5. An employee fell and broke his wrist after tripping over cables that had been left on the ground at a construction site. Now let's run through some ways of avoiding similar accidents. Plan your workspaces and access routes so they can easily
be kept neat and tidy. Risk assessments help you to identify dangerous places and implement the necessary safety measures. Make sure that indoor and outdoor areas are properly and sufficiently lit. Ensure there is good lighting in stairways, corridors, and entrances in particular. Sturdy handrails, good visibility, and slip-resistant floor surfaces also improve safety on staircases. Remember to carry out regular cleaning and maintenance. Make sure people can work at an appropriate pace. Accidents are more likely when you are in a hurry. Smooth work processes help to keep everything in order. Make sure you have enough time to get from place to place. Wear suitable shoes for the weather and your work. Keep your eyes open and focus on one thing at a time. Put things back in their place and don't block floors and access routes. Don't leave traps for your workmates. Always report any dangers that you notice and remove them yourself if you can do so safely. Let's make it safe to walk around the workplace together.
From the end of 2013, West Africa has suffered the worst Ebola epidemic ever. Since March 2014, MSF teams have fought the disease in an extremely complex environment. In December 2013, a mysterious disease appeared in Guinea. On the 21st of March, laboratory tests confirmed it to be Ebola. It spread in the area bordering Guinea, Liberia, and Sierra Leone, and quickly affected all three countries. MSF deployed teams to Guinea and Liberia. In April, 83 people had died. MSF described the outbreak as unprecedented. The worst was yet to come, with the epidemic spreading faster than the response by the international community. MSF intervened in the three countries, but was not able to respond to all of the needs. At the end of June, MSF said the epidemic was out of control and called for urgent action by the international community. The death toll continued to rise, with 670 deaths in July. At the beginning of August, the World Health Organization declared Ebola to be an international public health emergency. The virus was spreading like a forest fire. In September, there were close to 2,300 deaths. Each week, there were 600 new patients. WHO admitted that the epidemic was out of control. Joanne Liu, MSF's international president, told the United Nations General Assembly that the world was losing the battle and called for the immediate deployment of experienced civilian and military assets to contain the spread of the virus. Following the MSF appeal, the UN Security Council called for an emergency response from all its member states. This Ebola epidemic was the worst ever recorded, and it would kill more people than ever died of Ebola in the past 38 years. MSF concentrated its efforts on treating patients and supporting organisations that were willing to act. In September, the international community finally responded. Any actual implementation, however, only became noticeable in November. In 2014, over 24,000 cases and 10,000 deaths were recorded, while over 3,800 MSF staff were deployed. In January 2015, the epidemic began to slow down, but it was not over yet. From the end of December 2014, research was carried out for developing treatment, diagnostics, and a vaccine. In this first year of the response, close to 500 health professionals, including 14 MSF workers, had lost their lives in the fight against the Ebola virus. The state of the healthcare system is a huge concern. Facilities that were functioning poorly before are at risk of collapsing. In Sierra Leone,